recognizing these 8 disease states. I gotta get clinicians all over the country understanding beating cholesterol does not mean beating cardiovascular disease. That is just a component. Cast your net out much further. Now, there's some group of physicians that put most of their emphasis on diabetes, and certainly diabetes plays a big factor. As much as 70 to 82% of patients who go on to develop heart attacks show up to American emergency rooms with insulin resistance, at least as a basis for part of their disease. Thus, if you're going to be good at cardiovascular disease, you are going to have to be good at treating diabetes, and you can't just treat the blood sugar, you have to treat that inflammation related to the blood sugar. Hypertension plays a factor, and sometimes it's a telltale sign. I think we have a somewhat broken system in how we handle many of these inflammatory issues. For instance, in hypertension, we put a person on 1, 2, 3 medications to overcome hypertension. We get our systolic and diastolic blood pressure in an acceptable area, only to find out if this disease state's progressed. A few years later, we're adding one more drug, and a few years later, we may be adding another drug, and eventually this patient has an event, whether it be a heart attack or a stroke or heart failure issues, and now we've got cardiovascular complications. The correct way, I think, to take care of hypertension is to put the patient on that 1, 2, and 3 medications as necessary to get your control where it needs to be. Then you go after the inflammation that got the person to the hypertensive state to start with. Take care of the medical problem related to that. Then you start one by one removing plaque or removing what's ever causing constriction of vessels. And now you've got a patient who was on 1, 2, and 3 drugs coming off of 1 drug, 2 drugs, and eventually all drugs for hypertension. Wouldn't that make more sense than doing the other way around? Sleep disorders, highly respected in the United States. In the year 2000, 90% of primary care physicians never made not one single diagnosis of obstructive sleep apnea in their Medicare population that they were taking care of. It is absolutely impossible, in my opinion, to see 30% of your patient population or more is Medicare and not have one single case of sleep apnea. In fact, I would suspect you have more than 1 case per week. Therefore, if primary care physicians are not diagnosing this condition, now you've got your problem with a leaky faucet. What do I mean by that? We're sitting in this room, and there's a water pipe sitting right over my head, your head. It begins to leak. It's leaking rather large volumes of water onto the floor right in front of us. You grab a mop, I grab a mop, we're mopping this mess, but we're getting absolutely nowhere because the water is coming down on us as fast as we're cleaning up. You get that great idea to go turn off the water source, and when you do that, now the water stops leaking. We take those same 2 mops that we had no success with before, and now we have plenty of success. And you see, if you've got a patient that's got problems with cholesterol and problems with diabetes, but also problems with sleep apnea, and your focus is just on the cholesterol and the diabetes, now you've got a real problem because you've got a water leak, or basically an inflammatory factor leak that's coming from the sleep apnea. And until you treat that, you'll never clean it up, just like we didn't with the water and the mops. So you've got to go after this disease state. You say, well, I don't know how to keep these patients. Well, they have drooping soft palates, they have an enlarged tongue or an elongated tongue. Some of them have bilateral intranasal airway obstruction, much like you see my nose now. And those are telltale physical exam signs that help you identify that patient. You ask these patients if they have problems with fatigue. You see how much caffeine they drink in a day if they say no. Because usually when you see those physical exam changes that are prominent, they do have the disease state, and sometimes they cover up their fatigue through means of drinking a lot of caffeine or eating things with a lot of sugar, turning the air conditioner cold, using the music up loud, things to stimulate them to keep them functional. Now, I would encourage you to get the sleep study when in doubt, because you cannot afford to let that leaky faucet go untreated. How about chronic kidney disease? Certainly a sign that there's been cardiovascular trauma already, but also a creation of problems from inflammation from that disease state. You want to gain control of that earlier. I see another broken part of the system here. We've got problems with patients with chronic kidney disease that we don't even know about until they get to stage 3. So many doctors use the estimated GFR from a BUN and creatinine as their main means of knowing when this person's got problems with chronic kidney disease. The problem is many labs don't even report the actual number until it gets less than 60. Therefore, you'll read on your lab report BUN creatinine estimated GFR greater than 60. Therefore, until they get to stage 3 and show up as estimated GFR of 55, now you realize you've got a patient with chronic kidney disease, but they're in stage 3 chronic kidney disease. That's way late in the process. If you were using a cystatin C, you could get accurate recordings of when this person's estimated GFR got to 88, 85, 80, and you could catch it at the earlier stages of stage 2 chronic kidney disease, and thus giving you time to make a difference before this person gets to more advanced stage 3 chronic kidney disease. Once they get to stage 3 chronic kidney disease, oftentimes at that point, they're beginning to have problems with erythropoietin and problems with blood manufacturing from their bone marrow. And now you end up doing expensive injections of erythropoietin that wouldn't have been necessary if we could have just caught it earlier in the disease state. The patients would have much more quality of life, and you would have been a hero in the case of controlling one more leaking pipe. How about mental health issues like generalized anxiety disorder, depression, bipolar disorder? It's a known fact that patients that have